Different strategies. One is you obviously want to prevent it if you can, right? And so a lot of studies are being directed towards prevention. In fact, one of the sessions I saw where they reviewed the literature about, for instance, in atopic dermatitis, since the skin may be the source of exposure to the allergen, because let's say peanut in-house dust may be coming in contact with your skin. You may be using topical moisturizers containing peanut oil. And skin is a huge surface area, and if the skin is broken down, then obviously the allergens are going to penetrate more. So use of moisturizers very early on in life, the thick greasy kind that retain moisture, not the light lotions that disappear, have been studied as a possible prevention, and it has shown to have some help. Again, these are small studies and preliminary. Other approaches are, well, probiotics help. If we're using, if you're talking about the hygiene hypothesis, then you want to see if maybe changing the flora, the normal organisms in your body, to what's a natural thing, is that better? And there have been some studies showing promise in the prebiotics that if you start very early in life, it may help. We've always argued about whether having a pet at home is a good idea or not. And if you get them early on in life, it may be protective. Maybe vitamin D is helpful. So they're just different ways of prevention, and then we move on from there. In one sense, we have science to back what we do, and sometimes the science does go topsy-turvy. What is thought to be gold standard now changes. For instance, a few years ago, we thought that delaying peanut, egg, and highly allergenic foods was the way to go. We thought that children were getting it too early in life before their system was ready for it, and that's why they were developing allergies. And then we looked at studies and data that suggested that not really. The children exposed to peanut early, as in Israel, where peanut is a weaning food, and they use those peanut puffs to give it, they actually had less allergies. And then they did another study called the LEAP trial that you may have heard about, where they actually introduced peanut early and people didn't have more allergies, and that was amazing, and that was actually going in with a lot of what we were observing in our practice. So just to tell you how science does go topsy-turvy once in a while, but for the most part, we do know how to identify and treat them. We're getting better at quantifying, having tests. For instance, you may have heard about the component testing, which is instead of just checking what your allergy level to peanut is, we are trying to check what your allergy level to the anaphylactic part of peanut is, and what the cross-reactive part of peanut is, which gives only minor symptoms. So we are actually able to better predict severity in our patients and who might have a reaction versus not. Yes, the LEAP study came out last year, as you know. And since then, there actually has been a consensus group that got together and tried to come up with the interpretation of the LEAP study and what does it mean for practitioners. The LEAP study is one study, you have to remember that. And it took a very small group, not small, but a select group of patients who were allergic to egg or severe eczema, and then tested them. They also did skin testing and found that was better than blood testing. But as you know, blood testing is what practitioners can do, right? Only allergists can do skin testing, which limits the accessibility of patients to care. So you look at the science and you look at the practicality of it and try to come to a happy medium. And the consensus is that patients who are at risk may be referred to allergists for skin testing and counseling regarding early introduction of peanut. So they're actually recommending between 4 to 11 months to evaluate these children and introduce the peanut early, so maybe we can prevent peanut allergy. However, it's not always feasible because it's not like allergists are working all around the clock, so that part is a practical aspect. But they are going to look at it. The NIAID is looking at the implications of the LEAP study, and there's another ongoing study called the EAT study, which is looking at more than one food. and they want to see if they can apply these to actual practice and come out with guidelines that are more like mandates, do this or do that, rather than you may want to type of guidelines.